This is Hope and Help with Doctors Michelle and Mark Sherwood. Insights and interviews with a dose of straight talk to help you enjoy optimal health in all areas of life.
All right, well, we're back again, and I am pumped up. And as always, remember, before we dive into our guests, go to sherwood.tv, take 5 seconds to join our newsletter. Why, you say? Why would you want to do that? Because we want to keep you up to date on new interviews, new free resources to help you get better and have your best life. So again, visit sherwood.tv right now and subscribe. My guest today is Dr. Matt Hunt. We met several years ago, believe it or not, when I was doing some power team feats, breaking the bricks and bending the steel and breaking handcuffs and blowing up hot water balls. I actually went to Dr. Matt's place and put on a little presentation for some of his patients and the patients' children. It was a fun time. So I remember those days well, and we connected at that time. We've been friends and colleagues ever since. So Dr. Matt, thanks for joining us today. I appreciate it.
Yeah, thanks for having me. I have thought back just this week about just that giving spirit that you have, just coming out and just giving of your time and loving on kids. It was such an awesome event. I really still blessed to this day thinking about the time that you and the effort that you put out for that. I appreciate it.
Yeah, I put out some muscle effort too. I'm still sore from that event. Thank you, sir. No, just kidding.
That was like 10 years ago.
So, I want to kind of hit on a couple of things. You are a doctor of chiropractic by training. Now,
that's correct.
A lot of people would sort of say, okay, well, you crack them and stack them or whatever, however we put that thing, whatever. But I want you to talk about the different styles or modalities, if you will, of chiropractic. And then kind of which one do you lean to and why, and what makes it different?
Yeah, that's a great question. I get that question asked a lot because I am very different than what the typical person would go to. As far as education, chiropractic school is very much, we're all kind of taught about interference. What is interference? Interference to the nervous system. The nervous system controls organs, glands, tissues, muscles. It controls everything that we do. So when we're starting to talk about pain is only just a small, little tiny bit of what the nervous system does. But chiropractic, we're trained about interference. And when there's interference to the nervous system, there's going to be a problem. And most of the time, the people that are coming into us are coming in because they're in pain, they're having some issues, they're having headaches, low back pain, neck pain, they're noticing dizziness. There's, those are the big ones that we see every single day. So as chiropractors, we're trained how to find the interference and how to hopefully remove that interference. Along with that, there's several very specific techniques within the field of chiropractic, and there's over 250 techniques of chiropractic.
Wow.
So,
wait, you said 250.
Yeah, that's what I've heard. I mean, those aren't all taught in my school. There's, 7 very specific ones at Palmer College of Chiropractic where I went. And then there's, which they call the Palmer package. And we all have to learn that. And then there's several, other ones that are fringed upon that. But like the technique that I practice is still a very small, I am the only one in Oklahoma that's doing this specific technique right now. And so it's very, very specific to looking at the body as a whole, where when I was in chiropractic school, we looked at the body as, a bone out of place. Okay. Mm-hmm. And granted, I was talking to my daughter's martial arts instructor yesterday, and she was talking about, I think I have a rib out. I was like, well, those are easy to put back in. We can help with that. But usually there is some twisting that's going on to the body that will make those ribs go out of place. And so if you don't get to the root cause of the twist, but along with getting that rib out of there, there's going to be some issues.
I like how you put that because it is the concept of really this upstream healing approach that we talk about on this podcast all the time. We haven't talked about this upstream healing approach when we're talking about, pain, interference, bones out of place, joints out of place, et cetera. So you are talking about a style of figuring out why things happened. Would you say that's accurate?
Absolutely, absolutely. Going back to the first trauma and injury that we look at, and I'll just go back real quickly with there's several different the techniques. I started out with an upper cervical technique, which we look at the atlas specifically and making sure it's orthogonal, making sure that it's lined up with the head and the neck, and then everything else follows. And there's other guys that were trained really specifically with the pelvis and, making sure that the pelvis is balanced. And if the pelvis is balanced, then everything above will follow. Well, our approach, being a tensegrel type approach, is making sure we've got this three-dimensional fascia that's holding our whole body together. And we're working on the fascia of the body to align the whole body. So when someone's out of alignment, they'll come in and they'll have a high and low shoulder, a lean of the pelvis, a twist, the head and neck going off to the side. And I look at them and I show them from behind, what's out of alignment here? Which one bone is out of alignment? Do we have one, two, or are they kind of all out of alignment? Mm-hmm. And so this whole tensegrel approach that we have is just looking at a three-dimensional fascia and aligning the body that way, because the bones are only keeping the structure there, but the tension lines are what's holding us in place.
Now, when you talk about the fascia, I know what that is, but I've heard it explained like a sort of your fiber suit, sort of. I've heard it explained like that, but really kind of break it down for our listeners. What is fascia? What is fascial tissue? And then, when you talk about this misalignment, what does that mean that's happening with the fascia?
Okay, so I've heard it several ways. I like the description of like a Spider-Man suit. It's like you've got all these lines that are running from the top of our head. We've got fascia, we've got muscles and ligaments and tendons, and that's just running. Literally, you can follow some of this fascia all the way down to the toes. I had a guy, for instance, that came in the office last week. I hadn't seen him in a couple of years, unfortunately. But he came in. He was like, I was like, Doc, this is as much range of motion as I have with my arm. He goes, I can do this and bring it up. And so we worked on just in the fascia and his neck and that we always touch. And with that, after one adjustment, he goes,
oh, how cool was that, huh?
Well, he walked out and talked to his wife. I said, show your wife. We walked out in the little reception area, and he showed him. He started raising his arm, and her how her jaw just dropped, just watching his whole arm go up, because it wasn't a shoulder issue. It was a fascia issue that was holding the body in a locked and stressed position. And so a lot of times we'll talk about it even as a balloon type system. Mm-hmm. You start poking on this balloon and you start seeing all these, you can see the wrinkles going in there. It's all this, mm-hmm. It's a tensegrel type thing that's holding this balloon together, and you push here and everything goes to that area and it causes compromise, and you'll see it move, and the balloon will move in other areas. Our body's similar to that as well. As we're working with things, we'll start seeing the unwind of the body just through the fascia. It's really, really cool.
Now, we were talking in the office recently, you and I and my wife and your coworker, Dr. Paxton, and we were talking about, and I like the description that I think one of you used. It's like almost like a crinkled tin can that has kind of gotten off course a little bit. And you're talking about straightening up this whole fibrous muscular ligature structure and making it whole again in its original shape. Is that kind of accurate, what you're talking about?
Yes, for sure. We're, and one of the biggest things that we talk about with this is the twist. And just when we're talking about a can and how hard, it's pretty difficult to crush a can. But what's the easiest way to crush a can?
Twist it.
Yeah, to put a little twist in there, right? You put that twist in there, it compresses so much easier and so much faster. And so one of the things that we look at with the way we're looking at things is how the body breaks down. And when it breaks down with a twist. And when we see people that are out of alignment or misaligned and they have that twist in there, we just know that they're predisposed to having some really bad low back injuries when they're lifting and because they already have that twist in there. It's inherent. They don't even realize it. And so we not only do we educate about the twist, but when we make the correction, it's imperative that we're getting the twist out of the person's body, because when you have that twisted can, to take that can back up again, you got to you can't just pull it straight up. You gotta, if you twist it, it unwinds a lot better,
Mhm.
but you still have all those wrinkles in there that you've got to work out to try to get it back to functioning as optimal as possible.
Now, you mentioned the one gentleman that came in that couldn't lift his right arm above his head.
Yes.
Is that the type of response you typically get with that fast of just adjusting?
I would love to say that is what we always see. It is not what we always see. That's it. For some reason, I felt in my spirit that I wanted to see what we had already done. And so I just asked him to do that motion. I would say that we do get great changes, but it's not always that fast. Everyone responds differently.
Mhm.
It depends on how long the injury's been there. His for sure has been over there over 8 months, and he wasn't able to lift it above that without pain in 8 months. And so it's always fun to share that. And it's not always a spinal issue when someone has the type of injury. I would say we get really, I don't want to say how often we see good responses, but we see responses fairly quickly. We really do.
All right. So there's people out there that have experience with general chiropractic where we're dealing with the subluxations of the spine. I think everybody knows what that is,
Yes.
the manipulation. Obviously, you're different, right?
Yeah.
You're talking about a whole different viewpoint, perhaps, of this. What types of people would typically want to go see Hunt Spinal Care? What types of people do you want to see in there? What kind of symptoms would they exhibit? And thinking that's where I need to go to get results.
Okay, great. So one thing is we can help anyone that has a spine. I mean, we really, I've got a young man that came in, had 11 fusions in his spine, a lot of stuff going on. And we didn't have to move bones to give him some relief. Now, unfortunately, we do typically see most people that are in pain. Now, we do get the occasional person that says, hey, I just want to be healthier. I just want to feel better. I want to be optimal. And so those people we can help as well. But the typical people we're going to see are like I mentioned earlier, the headaches, the neck pain, the low back pains, rib stuff in between the back, in between the shoulder blades. Those are the big things that we'll see as far as pain issues. And we get great responses.
When someone comes in, obviously, that's the kind of, we would see those things. They're common maladies or common complaints of symptoms around the globe in different places. They end up in primary care offices too.
Yes.
You're talking about dealing with something from a fascial standpoint versus really a musculoskeletal and or probably both. But, when you got these people coming in like this, what are they going to get from you that would be perhaps different from the traditional or more of the subluxation manipulation chiropractic care?
Okay. So I love chiropractic. Chiropractic works. It does. It helps a lot of people. The traditional people that we will see, a lot of people that are coming to us are coming from either they got lucky and they found us. I kind of jokingly say that because, I think that, we do the best that we can. I give our 100% every single time and we do really good work, or they've been the other route and they didn't like the twisting or the popping or the cracking. And so with our approach, it's very, very gentle. There's no twisting or popping or cracking. That's something that is a pretty big benefit that a lot of people like the idea that, Uncle Bob went to the chiropractor and he saw stars. I don't want that to happen to me. And so that's not really why I do what I do. I've been under this type of care for years. And as I grew up under chiropractic care, I saw the benefits that it did, not just with aches and pains, but even in sports, I felt like I was always a little step ahead of the other guys on the team.
Now you obviously have chosen this unique niche. You kind of touched on it, but kind of go into it. What drove you down this pathway to say, I'm going to go in this area and this is what I believe in? What was that thing?
Wow. Just like basically from childhood, my mom was going to the chiropractor, and in his office, she saw a sign on the wall or was a poster on the wall that had like a bent tree on it. And it said, as the twig is bent, so grows the tree. And that just planted the seed in her mind, which I need to find that for my office. I love that. That planted a seed for her that, wow, I've got this kid at home that has fallen a lot trying to learn how to walk. He rides a bike now. He's fallen off of his bike. He's in sports. He's an athlete. There's things that he's going to need some help. And if I can catch this early on, it's going to make a difference. I noticed, I'm not a tall guy by any means, but I played basketball, loved playing basketball. And I noticed a difference between when I was in alignment and when I was not in alignment, not from pain or aches, but how I performed on the basketball court. So those are the things that drove me to do what I do. I love when I was sixth grade, I made a decision that I wanted to be a chiropractor.
Sixth grade?
Sixth grade.
Wow.
I loved helping people. I loved talking with people. I loved being around people. I loved working with my hands. And so it was just a great fit for me just to be able to say, hey, not only, my passion is helping people, and now I get to educate, and I get to not about just physical, but chemical and emotional things as well.
Is it going to cause people pain when they come see you for your treatment?
I will say almost 100% of the time, we're not going to cause any pain. Yeah. I have a person coming in from Oklahoma City that a chiropractor there referred to us a couple weeks ago. And there's always some interesting cases that you're going to run across that are going to have different responses. But me putting my hands on you, it's less than a massage type of a feel when we work on the person. And so everyone responds differently to it. Sometimes people won't feel anything that day, but the next day or that night, their muscles are sore, like they had a good workout. Yeah. Or even 3 or 4 days down the road, I'll warn people that sometimes you might have some neurologic things kind of show up, come and go away. And that's a little bit what my Oklahoma City girl is kind of noticing. She's noticing some old injuries that were there that haven't been addressed. Her nervous system's starting to wake up. She's feeling some of these aches and pains, and she's like, what's going on?
That's fascinating you said that. I want to kind of touch on that because a lot of times people, I'm going to see it in our office a lot. They misinterpret, and it's the wrong context of pain. Pain is telling you something. So yeah. I want you to kind of tag on this idea, and you can use her case as example. What does pain tell you? What is being communicated in general with that?
Well, from my experience, what I've seen is sometimes people's bodies have just shut down. I mean, old shoulder injury, it's there. It's been there for years. And your body has just said, I don't know what I can't do anything else. And so we start opening up those pathways for that nerves to go to that area and that nerve to go back up to this area. And it starts just showing some pain. It starts letting the body know that, hey, there's something going on there that needs to be addressed. And usually when that happens, I got a phone call from her on Saturday last weekend. I saw her on Friday and she was like, what's going on? Yeah. But by Monday, or actually by the end of Saturday, her body had responded and had adapted to the new place that we had put it in.
So in that context, the sort of the reappearance of pain was actually a benefit because it was telling you got nerve connection there, giving the signal that it was supposed to be all along, but it got tired of doing that and it wasn't getting any resolve. Is that fairly accurate?
You got it, Doc. Absolutely.
So, when you have someone, if you had to, there's a lot of people who listen to our podcast around locally and nationally. What kind of person, I mean, you mentioned that they got a spine, but what would be your ideal person or persons to see?
People need help. We have a mission just to help people. Our goal is to give 100% all the time to help them physically, chemically, emotionally. We've got several things that we can help people with. People that are dealing with everyday aches and pains that they think that it's normal. I think you said something very well earlier. It's common that people hurt, but it's not normal. It's not a normal thing for people to be in pain, right? And so I think those people that have some common aches and pains that they would love to have addressed. I've had people that have come in that have had headaches for 3 weeks every single day, and we adjust them, and within a day or two, they don't have headaches anymore. I've got several patients that have Meniere's that I've got one lady right now that she's like, I'm ready to get off some of these medications. And I've been telling her for a year that she should be getting off these medications, but she's like, I haven't had a migraine in like almost a year. And so she's just amazed that she's doing so well through the gentle chiropractic approach. And she's just on a regular wellness maintenance kind of checkup thing right now. And she's just doing amazing. So we have a lot of different people that just think that headaches are normal. And educate people that headaches are not normal.
I think you hit on something key right there. And I want to piggyback on it a lot because I'll use the word interference. There's a lot of interference right now with truth, and truth gets clouded. And some of the interference says that it's normal to be sick. It's normal to be on these medications. It's normal to gain extra fat tissue. It's normal to not feel good. That's part of the aging process. Folks, that is just nothing but interference, and it's garbage. It will cloud true information every time. And we've got to correct the communication in the body, much as we correct the communication with each other. Now, I will tell you, as by the time, you're listening to this right now, my wife and I had already been treated by Matt. So we are, if you're hearing our voice, we're still alive. So there's a good thing to know, right? But no, we're excited because we believe in what you're doing. We believe in how you're doing it and love the heart behind it. How can people get a hold of you, follow you, connect with you, see you? How does that work? And kind of tell us about what maybe once they do that, what does the first consult look like?
Absolutely. Great question. The best way to get in touch with us is via phone. You can go to our website and we will reach out to you. If you want us to do that as well, we can call you directly. Our phone number is 918-459-0333 and 918-459-0333, just in case they don't want to rewind for a second there. And then also we can do online. You can set up appointments that way.
What's your website again?
HuntSpinalCare.com. HuntSpinalCare.com.
And we will make sure, folks, to put the website, Dr. Matt's contact, in the show notes below the feed. So make sure you go by there. And if you're in the area, and I'm not just talking Tulsa area, I'm talking about the regional area, it's worth your visit. I know Dr. Matt personally. I know his family, his parents I know, and it is a blessing and honor that I get to call him my friend and introduce him to everyone today. Matt, there's people out there right now. You got the show, the floor right now, and they're hurting. They're like they've got pain. They've got this persistent thing that's going on that they've said it can't go away. It's impossible. Their primary care has said you got to live with this. Just toughen up. Take some Aleve. Take some ibuprofen, and cowboy up.
Right.
What are you going to tell that person?
So there's many things you can do. I have patients every day that come in that, ibuprofen could help them. Aleve could help them. What are you interested in? Are you interested in getting to the root cause of the problem? Are you interested in just treating a symptom? That is what we're after. You asked me earlier, what do we do on an initial visit? I didn't get there. I apologize. Initial visit, we want to find out if you're in the right place. That's the first thing. If we fill out the information, I sit down with you for a short consultation to find out what's going on, find out if you're in the right place. I've had people that I said, you are not in the right place. There's a time and a place. You've got to know if this is up your alley or not. And so that's one of the first things we need to find out. I've had people that have come in for chiropractic that needed neurofeedback. And we offer neurofeedback in the office because there's not just a physical thing going on. There's an emotional thing that's attached to how their brain is functioning. And if we can help them with their anxiety or their depression or their ADHD, it's going to help their entire body function better. So that's another aspect that we haven't gotten to yet. But that's just part of that initial consultation to find out what we need to do. And the next step would be, we do that's posture analysis, because just like all of the other chiropractors, there's some kind of analysis that we're due. But when we look at the spine, we look at that pelvis, we look how it's twisted, we look at the spine, we look how it's leaning, we look at the shoulders and see how it's leaning and how they're twisted as well as the neck and the head and how everything is moving around. That is part of the initial consultation. And we do that on every follow-up visit because We don't want to take an x-ray every time. We don't need an x-ray every time. We just want to see at what point in this flow pattern we're in and how to continue to unwind the spine and that fascia so that the body will be able to function optimally, so there'll be as little, if no, interference possible. We also do some tests and some exams in the back that measure, kind of like I mentioned earlier, pain is 1/9 of the nervous system. The other 8/9 is controlling the organs, glands, tissues, and the muscles. We have an instrument in the back that measures how the muscles are functioning right off of the skin paraspinally, as well as the thermography, finding out how the autonomic nerves are functioning from the spine. So these are things that we're able to measure and follow up with as well. If we find anything going on, we take some x-rays to see what is going on, because you kind of like, it's nice to hear the engine, you kind of get an idea of what's going on. But if you're a mechanic, you probably still want to look under the hood at some point. So we get those x-rays just to make sure there's nothing crazy going on and make sure that we're in the right place. So that's the initial consultation. I always try to find out where people are at. If they want just symptomatic relief, okay. But if they want to dive a little deeper and get some optimal recommendations on the follow-up visit, that's when we go over everything. And we just say, hey, this is what we would recommend. We have laser therapy that will help out with ligaments and tendons and soft tissue issues and muscles, all of these types of things that will help your body heal faster, as well as along with the chiropractic adjustment on the chiropractic side.
When you say complete spinal care, you mean it, sir. That's impressive. I love that. So we have indeed, folks, we've shared patients back and forth. So I have complete confidence in Dr. Matt and his team. Most importantly, you have confidence in you as an individual person. So that means a lot. And I really appreciate you joining us today. Website one more time, and number one more time.
Our phone number is 918-459-0333. And the website is huntspinalcare.com or the tulsachiropractor.com.
Love it. We'll make sure to have those in the show notes. And folks, this is what we're talking about. Healthcare, the missing link is really not having the right team around, quite frankly. It's not having the right faith around. It's not having the right belief around. And we got to change it. And I think Dr. Matt shared a new word for us today, interference. Get out the interference. Dr. Matt, thanks for joining me today. I'm really grateful. So thank you.
Thank you for your time.
Well, folks, there it is. Dr. Matt Hunt Spinal Care, Tulsa, Oklahoma. If you're in the area, get in the show notes right now. Call them. Look at my website. You can schedule an appointment there. You can schedule a phone call. They can call you back and talk to you a little bit. Make sure to go once again to Sherwood.tv. Take 5 seconds to subscribe to our newsletter. Why? Because we want to give you some free stuff and find out what and who's coming next. Of course, that's important. So Sherwood.tv right now, and we'll look forward to seeing you on the next edition of Healthcare's Missing Link. Bye for now.
Doctors Mark and Michelle Sherwood and their clinic can help you find the hope and health you were created to enjoy. Go to Sherwood.tv for clear, proven ways you can be healthier. Subscribe at Sherwood.tv.